Okay, Dr. Kumar, I invited you to speak. I want to give you the co-host, but how are
I'm doing
you?
wonderful. Hey, can you hear me okay?
Yep, I can hear you
Oh, good,
perfectly.
good, good. All right. I'm ready whenever we got
Well,
folks in.
happy hump day. Happy
Oh,
Wednesday.
thank God. Yeah. It's been a good week.
We're halfway there.
Yeah, it's been a good week.
Yes, that's good.
Yeah.
So, I wanted to go ahead and share out the the article that you sent me about ozone therapy.
Mm-hmm.
I'm gonna put that on the nest. And in the space here also is Dr. M. He's a doctor in Michigan.
Yep,
I think you both met before.
I think so.
Okay, I pinned up the article, the ozone therapy and COVID-19, a narrative review. Um, I didn't put that in the title because I
It's
just
too
had
confusing.
problem last week.
Yeah.
Well, no, from last week I had problem with I don't know, it's just the word COVID. I think on any health segment you tend to not like it too much. So, let's talk a little bit about inflammatory markers when it comes to anything that's especially with COVID. But I think that's the key aspect of COVID, isn't it? Like people they get this was it the cytokine storm?
Yeah. Yeah. So, are we good to start?
Yep, we are ready to go.
Okay, perfect. So, the thing is this. So, I had a patient this morning and he was talking to me about, his little kid, 8 years old, to vax or not, and stuff like that. So, and I asked him, what did he understand on how COVID-19 causes problems, right? And very few folks have this understanding of what's called the cytokine storm. We as physicians, we get it, but most folks out there have very little understanding. So this is what I told him. Listen, it's like, you have a minor attack on your body, but instead of just defending it, you throw a nuclear bomb at the whole thing, destroying the virus and destroying yourself at the same time. It's just a massive overreaction of the body. I mean, that's so the virus causes the initial damage, but what perpetuates and magnifies that damage is the body's reaction to it. So hopefully that, if this is recorded, hopefully this little way of understanding how COVID-19 damages us, I think will really help these folks make a decision on what to do about COVID. But apart from that, so I was talking to the same patient about ozone. Now, not a lot of folks understand what we call medical ozone. So the moment I mention ozone to anybody, the first thing that comes to their mind is, oh, we use it in our office as a disinfectant, and we've heard about the hole in the ozone layer, and then they talk about ozone being toxic and all kinds of issues. So hopefully through these discussions, we will be able to kind of help people understand how medical ozone can really revolutionize so many things in the medical field. So I think we really need to have a clear understanding on what ozone is. How is medical ozone different from the concept of ozone being quote unquote being poisonous? I think that would be a good thing for people to understand. What do you think, Tanya?
No, that's great. Like we have like explained the basic. I mean, I was introduced to ozone therapy back in the 90s. I met this gentleman. His name was Michael. He was a doctor, and he was traveling. He would go to South America and
Hmm.
do this therapy on the villages, and he told me how poor they were, and he's told me that how all the different results he got. And then he would come down here because he was setting up an ozone thing, some type of project with University of Miami. So that's how I know a little bit about that. But I've heard quite a bit about it in the last 2 years. So Why don't you tell us a little bit more about the ozone therapy, and also what how is it doing for you in your practice?
Okay, perfect. So I was introduced to ozone therapy by really, serendipitous circumstances. My training in acupuncture kind of led me to this thing that people were talking about in my group called prolozone. I was wondering what the heck that was. So finally, I ended up being trained with Dr. Schallenberger. A big shout out to Dr. Schallenberger. He helps clients in his office in Carson City, Nevada. And he's just an amazing guy. And he's led me through this entire process of understanding the value of ozone therapy across every medical situation. So let's start off by understanding what ozone is. Ozone is basically three atoms of oxygen linked together, whereas oxygen is O2, which means two atoms of oxygen linked together. So, ozone therapy for industrial uses has been going on since the mid 1850s, and medical ozone has been really in play over the past at least 100 years. Came out from Europe, actually came down to Florida way back, and it was recognized by the FMA at that time, Florida Medical Association. But anyway, so it kind of lost its charm with the introduction of pharmaceutical drugs and stuff like that. But now it is beginning to make a resurgence based on having these, giants in this area trying to spread the word, and having other physicians kind of figuring out how it can help uh, patients in their particular practice. So I've been using ozone therapy in my practice over the past 4 or 5 years, ever since I got trained by Dr. Schallenberger. So, what are the most common ways or indications for using ozone? I mean, Dr. Schallenberger talks about how any kind of an imbalance in the body can cause what we call our disease conditions. So he tells us, think of issues that cause stress in our body. What are those stresses? So infections, okay, whether it's an infection that's obvious, like the COVID-19 infection, or an infection that is subtle, which means, having, if people, we tell people to floss teeth, and, not a lot of people do that. So we have these kind of hidden infections in our gums. We have bad bacteria in our gut. So these are all the kind of mild infections that are flying under the radar, but are causing enough damage that are adding to an imbalance of our human biological system. The third thing is like toxins. We are exposed to lead in gasoline, whatever smoke, um, and mercury in our fillings, and it just goes on and on and on. Um, the other stressors are emotional, right? So the stress of just the fact that we are alive in this day and age is enough to trigger all kinds of emotional issues. So we have been seeing this big spike in addiction issues. Again, people trying to find ways of trying to mitigate the emotional roller coaster that people get involved in. They just want to be numb to it. So people end up with alcohol issues, drug addiction, mental health issues, and so on and so forth. The other thing that can cause stress is, or another stressor is just injuries, whether it's trauma from an accident or surgical procedures. All that will continue to add a stressor that will have an impact on having our biological system in balance. So, what are the others? Nutritional deficiencies, vitamin deficiencies, allergies, to things that are may not be obvious, but again, if you do a deep dive, you can probably isolate all these conditions that creates an imbalance in the biological system. So, what we understand by using ozone therapy, not as a standalone, but integrated with everything else that we do as physicians, will help restore the biological system that was off balance back into balance. So it's fundamental. Oxygen is fundamental to life, correct? We all agree on that. That extra atom of oxygen will help mitigate most of the stressors and the imbalances that we are subjected to. So, how do we utilize ozone? So, I want to remove some kind of a misconception that we have in the medical ozone therapy world. Number one, that it is harmful. The only time that ozone therapy is harmful is if you inhale it. Okay. I kind of wanted to kind of experiment and see. So I had a tiny amount of ozone that kind of got into my lungs, and I coughed my guts out for over an hour. It was just non-stop irritation. It's a massive irritant to the bronchus and the lungs, right? So never, ever, ever, ever inhale ozone. That's an absolute no-no. But the way to overcome in case there is an accidental exposure to ozone, inhaled ozone, is high dose vitamin C. And I discovered that will help kind of minimize the damage to the airway from inhaling ozone. Um, the other thing that we do not do with ozone therapy, and I know there are some physicians who advocate this, is using IV ozone directly. And Dr. Schallenberger is very much against it, because there are better and safer methods of getting ozone into the system, and that can do the same job, or even a better job in a safer way of delivering ozone rather than taking ozone gas and trying to push it into the circulation. That's a no-no. So if you bar these two things, it's a very safe method as long as you work with a physician who has some idea on how it works. So the question that I get asked is, how does ozone work? And there are very basic things that we need to understand about ozone. For example, when we check a patient with COVID, right, we check their lungs. So what do we look for? We look for their oxygen saturation. And let's assume their oxygen saturation is 97. But you see them, they're still out of breath. They're still huffing and puffing, and their O2 is 97. Now, one of the reasons that happens is a problem with oxygen utilization. Now, let me kind of step back and kind of help people understand what it means. So, you can have the oxygen in the blood being transported to a cell, but if that oxygen is not taken out of the blood into the cell and fed into the mitochondria where it's being utilized, that oxygen in the blood is completely useless. I mean, you can have 100% O2 sat, but if the oxygen is not being utilized in the cell, which is the problem with COVID, which is what that article talks about, you have to do something about creating improvement in oxygen utilization. And that's what ozone therapy does. It improves oxygen utilization. It also helps improve oxygen delivery, which means the red cells, which are causing oxygen as we age, have to navigate through smaller and smaller blood vessels because as we age, our blood vessels start getting narrowed down. I'm not talking about the major blood vessels, which is a very well known fact, but we're talking about microvasculature, where the red cells are now becoming brittle and they cannot kind of squeeze their way into the cells through these narrowed passages. So what ozone does is once it interacts with the cell membrane of the red cells, it becomes a lot more flexible. It basically starts behaving like a younger red cell. Now it has the capacity to kind of squeeze its way in to these tiny blood vessels that are narrowing down and still be able to get the oxygen down to the level of the cells. So if people can remember these two things, and biochemically, what it does, and Tanya, we've been talking about this forever, it also helps increase NAD levels. Okay, so that's the end product of how ozone therapy works. Now, where do we use it and how do we use it? So, where do we use it? Like I said at the beginning, across the board. You have a pulse, you probably need ozone therapy in some form or the other. Specifically in my practice, where I use ozone therapy is chronic pain issues. I'm talking about fibromyalgia, chronic fatigue syndrome, or isolated areas of pain like knee pain, shoulder pain, back pain, across the board, any kind of a pain issue. And number two, because of its ability to increase NAD level, I'm advocating ozone therapy as part of an reversal protocol. And we can have a separate discussion about age reversal. And I know, Tanya, you kind of, you're passionate about that, and me too. So ozone therapy does have a role in helping us manage aging. Um, Number three, again, stress issues. Any place when we talk about the biological systems that are off balance, ozone therapy in some form or another can help achieve balance. So stress reduction, just feeling better, peak performance, because all of us need that increased oxygen utilization as we get older to kind of put us back into a better performance status. Our muscle power can increase, our ability to work out can get better, and so on and so forth. So, how do we deliver ozone therapy? The easiest way of delivering ozone into the body is several methods. Number one, you can inject ozone gas into areas of pain. Now, I integrate this with my acupuncture skills. So, not every patient will get the benefit of ozone injection if you don't take care of the rest. Obviously, if there's an infection that's causing pain, you better correct the infection first before you start messing around with pain. So you don't want this, so you got to kind of have a medical background before you start thinking about ozone. I have quite a few patients coming in saying, "Oh, I just need ozone," and you look at that area, that whole area is swollen up. There's thrombophlebitis in there. There's infection in there. There's a diabetic foot ulcer that's oozing, pus in there. You don't mess around with that with ozone. You correct the underlying issue with that, and you help enhance healing. That's when you bring in ozone. So you can inject ozone into areas of diabetic ulcers. You can use ozone gas into areas of pain, and you don't even have to enter the joint to create pain relief. You can even inject it into just the skin, under the skin, around that area, and that's more than enough. And you just need a couple of sessions. You don't need a whole bunch of it. But again, ozone needs to be considered as a medicine because there's a dose to it, there's an amount of ozone that we need to inject, there's a frequency to it, and it's kind of individualized to each particular situation. That's one. The second thing that I do is I also have what's called an ozone sauna. And basically, this is like a closed unit. You guys can go Google and look at pictures of these ozone saunas. Basically, you need to make sure that your head is outside the unit because you don't want ozone, like I said at the beginning, you do not want ozone getting into your lungs, right? But so the way these ozone saunas are designed is, below the neck area is when you can bathe your body with 105-degree Fahrenheit steam. So there is a so you got steam out there, and then you infuse ozone into that mix. So now you have ozone mixing with the steam, and that's having an effect on the skin. And basically, the way that works is it creates what we call lipid peroxidation. It's a fancy word for saying the ozone gets absorbed into the skin by interacting with the lipid layer of all the cells in the skin. And that lipid peroxide or the ozone that's mixed with that the fat layer, that's what gets absorbed into the skin, into the blood circulation, and that's what does all the benefits. And people feel like $1 million once they go through with it. But again, have a deep understanding on what's causing the initial problem before you start messing around with ozone. Now, I have not done this, but we have the capacity to do this. It's what is called major autohemotransfusion. Now, there are studies going on in University of Miami and a bunch of studies going on in India and in a few other countries where to help patients with either acute COVID infection or in their recovery is when the process is called major auto hemotransfusion. Now, let me break that down. It's not that complicated as that term implies. So basically, what we do is it's just like a patient donating blood at a blood bank. So we draw out about 250 cc's of their blood. So before we do that, we have to make sure that their blood is thinned out with about 5,000 units of heparin IV. So what happens is, and again, you got to be careful that you have the right patient for this procedure. So it's not um, a procedure that doesn't have side effects or complications. Bad things can still happen, especially with 5,000 units of heparin. So you got to pick and choose your patient who is appropriate for this procedure. But once you get that heparin in and the blood thins out, you drain that blood into an IV bag, and which is mixed with saline, and then you infuse a certain amount of ozone gas into the bag that contains the blood. Now, because that blood is already thin, it's not going to clot on you. So once you spend about 5-10 minutes mixing a certain amount of ozone gas into the blood, now you have what's called ozonated blood. Now you have healthy red cells, you have lipid peroxides in that blood, and now you infuse it back into the person. So it's autohemotransfusion. So there's nothing coming from the outside except for the ozone gas that's mixed with the blood in the bag. So instead of trying to push ozone gas into the bloodstream, you do it outside that person. You mix it up, so there are no gas bubbles out there. So in fact, this is something that I want people to understand. Most of the gas that we call ozone gas should actually be called ozone plus oxygen gas. Okay, because most of the gas that we're injecting, either into the bag of blood or into the skin or into the joint, is mostly oxygen. But the small amount of ozone that's there in the mix, again, there's a certain amount of dose to it. And it's all calculated, and Dr. Schoenberger has given us protocols and so on and so forth. So once we introduce that small amount of ozone is the one that actually creates these massive changes. And the ozone doesn't stick around for too long. It just takes a couple of minutes for the ozone to break up into oxygen molecules. But in that brief moment, that ozone interacts with the lipids, sets off this chain of biological reactions. And that what helps. So when you do this procedure in patients with COVID, where it's not only an oxygen delivery issue, but an oxygen utilization issue, so you really make a big difference when you inject this ozonated blood, because now you're having the patient's cells recover because now you have improved their oxygen utilization. That was really very poor because of the damage that was created by the ozone infection. And with that, I think I'm going to stop. So,
No,
field
you're
any
great.
questions.
So I think Bryce, did you want to ask a question?
Oh, sorry. Yeah, no, I was having trouble unmuting my mic. No, I was just, no, I was listening. It's very interesting. You said I know nothing about it. I was trying to do some quick research on it. Is it an FDA approved treatment for anything, or is it?
No, it's not FDA. So the thing is, FDA doesn't approve the procedures.
Uh-huh.
Okay? FDA approves the mechanism. Say, for example, we are utilizing oxygen, right?
Yeah.
So the way we create ozone is by feeding. So let's kick back and think about how ozone is being produced on the planet. It's a natural source. So you can't have patent ozone, right? It just can't happen. It's just not feasible, right? So ozone in on the planet on Earth is being created by the effect of lightning on oxygen molecules. So oxygen molecules O2 is broken down into OOO, and three of those atoms come together for ozone. Okay, so it's naturally existing. Now the key here is the FDA doesn't, like I said, FDA does not regulate procedures. It can regulate equipment. And if you regulate ozone, then you got to worry about ozone or oxygen. So we get medical oxygen cylinders that we use for any other purpose in the medical office, right? For patients who have difficulty breathing, you can give them a little bit of oxygen. So that's the kind of medical oxygen that we utilize, and we push that through a little machine that will interact with the oxygen, and out comes ozone. And there's a certain amount to it. It's a lot of nuances. People have to see this procedure to actually experience it.
So
and make sure it's safe.
So who's a typical people? So it improves circulation. You said you could use it as an anti-aging thing. Like I'm in my late 40s and I weight train. Would this help with like recovery for your
Absolutely.
muscles and things? Okay, go ahead.
Absolutely, absolutely. And so the simplest way of doing that is an ozone sauna. Okay,
Okay.
it's about takes about 15-20 minutes. Have that, if you guys are located in Florida, you
I'm in
can.
I'm in I'm in Los Angeles. Yeah.
Oh, I'm sure they have it, man. I'm sure if you
Yeah.
look around for
I'm
ozone
sure they have
sauna.
it. Yeah. Yeah.
Yeah,
Okay. I'll
I mean,
look around.
yeah, look around. As long as you don't inhale it, and I'm sure people who have the ozone sauna would know that. But for somebody your age, I have a little protocol that I would put you through for peak performance. One
Yeah.
would be, do your whole. If you're familiar with far infrared light, do a sauna on that first, and
Okay.
then you do your ozone sauna. So the red light sauna, which there's a company that manufactures that. It's called Novothor, Novothor. I have that
Okay.
machine in one of my offices.
Hmm.
I'm sure if you're in LA,
Yeah.
Bulletproof will have that. I'll take a bet they do.
Okay. Yeah. I'll look
In
around.
Santa
That's
Monica.
interesting. Okay. Yeah. So yeah, I'm not far from there. So,
Yeah, take a look at
so
their protocols because their protocols are very similar to what I run.
do any athletes use this? I mean, as kind of an
Oh,
alternative?
absolutely. I mean, the thing is this. So, I mean, you understand about cryotherapy, right?
Yeah. Uh
Okay. Listen, this is much safer than damn cryotherapy.
huh. Okay.
Okay. Because you're not freezing your butt off, right?
Right.
I
Right.
mean, the stuff can happen in cryotherapy. I mean, with those extreme swings of temperature, God forbid. So cryotherapy is not for everybody. Somebody like 40 years old, I'm sure, because I've had that, gone through that process too. But ozone sauna is probably one of the easiest and the best thing that you can do across the board. So when people come to me for auto hemotransfusion, I tell them, listen, let's try the ozone sauna. It's safe. You walk in there 20 minutes, you walk out. That's it. We're done. Do it once a week, twice a week, and you see the difference as you walk out. So it's not only the steam sauna that gives that benefit of improved circulation, right? So the steam improves your heart rate, increase your heart rate, causes vasodilatation, and now you're
Hmm.
pumping ozone into the mix, right? So can you
Right.
imagine you're delivering ozone to the blood that is hyperdrive circulation, right? So you're
Yeah.
not only pumping in ozone into that blood that's circulating at a much higher rate, but actually improving oxygen utilization at the level of your muscular cells. And you combine red light therapy on top of that, man, you're going to be like Arnold Schwarzenegger.
Now you were saying before too, and I was listening in, and I kind of faded out a little bit for a few minutes. Was because that's a big thing with COVID, right? Is the lack of oxygen in the blood? Could this be seen as a treatment to like super oxygenize maybe the blood? Maybe I'm saying the wrong things.
No, no,
Uh,
no. You're on track. So what we are talking about is there are two problems with acute COVID infection. Number one is oxygen delivery.
yeah.
Okay, which means if your lungs are damaged, right,
Yep.
they will still try to kind of push some oxygen through. And when you're struggling, you're on a ventilator and whatever, right? So you're pushing oxygen through the lungs into the blood, right?
Right.
So
Right.
you have methods of doing that. But so far, none of these folks have recognized that the second problem that's not being addressed, that you're leaving quote unquote to God, is oxygen utilization at the cell level. So when you look at that article, that's exactly what they're talking about.
Okay.
Okay. It's not so we can't do anything much in the alternative arena about increasing oxygen supply through the lungs. You go through a ventilator, whatever, that's there in the ICU setting. But at the oxygen utilization level, you need your NAD, you need your ATP from red light, and you do need your ozone therapy. Like I said, auto hemotransfusion, or if that's too dangerous, to at least put them through an ozone sauna. I think this will be the future of medicine, to use ozone therapy as an adjunct to all the stuff that we can do, whether it's recovery from surgery, or trying to enhance wound healing in somebody who has very poor circulation, such as diabetic foot ulcers, or I mean, I'm an oncologist, so my interest is trying to figure out how we can utilize ozone therapy for cancers. They are trying to expose ozone for superficial bladder cancers. So there's some data that's coming out, and and again. So this is something that I forgot to mention to you guys. It's a very simple thing that I think anybody who's listening to this can go on
Mhm.
Amazon and buy what's called pure O3 ozonated olive oil. It costs about $20, so you can use it, for aches and pains as a first aid. It's much better than anything else that's there on the market right now.
Do you use that? Do you use that in a specific area, or is it just
No,
absorbed into the
as
bloodstream?
long as you're not pushing it into your nose.
Oh, okay, yeah. To the lungs is bad. Okay, but
Yeah,
but what I'm saying, when I'm rubbing it in, it's just being absorbed through my skin, and so it gets in my
exactly.
bloodstream.
And the
Okay,
thing is,
okay.
it's such a small bottle for just regular first aid and simple things. That small bottle, $20, can last you 6 months to a year easily.
Is there research with it you said for cancer? What about just as like an antifungal or
Oh,
antibacterial?
absolutely. Absolutely.
Okay.
Remember, ozone first came out as a disinfectant.
Right. Okay.
Okay. So you can use it for Lyme disease and all kinds of those weird infections that we've been talking about. You know,
Okay.
so for fungal infections of the toes, it's huge. Again, if you utilize red light therapy and ozone oil on that area of fungal infections on the toes or whatever, you will see a much dramatic result. I'll give you one last anecdote. I think we are coming up to closing time. Just the last minute. So I had one of a huge businessman with nearly 40,000 employees under his control, multinational. So he came out. We don't know what causes, but big lesions on his skin right around the body. Sent him around Palm Beach County to a bunch of doctors. All they gave him was steroids, um, anti um, um, antihistaminics, and antibiotics. That's it. Nothing solved his problem. So I said, listen, come and let's try to do some ozone therapy. So I just injected like less than half a cc. I started with one lesion under the skin, right under that, around that lesion. This was like a 4 or 5 centimeter lesion on the backside of his hand, of his right hand, to the point where he couldn't even go out and meet people because it was so damn obvious. And 2 days later, my friend, it was gone. And then I start hitting it through on his scalp, on his legs, on his arm, on his chest, and we resolved it within a couple of weeks. So
That's
that's
great.
one of my biggest wins.
Yeah, that's a good anecdote, though.
Yeah, yeah,
That's a hopeful story. Yeah, I like it
yeah.
just to the general recovery, and you're getting more oxygen, more circulate. I mean, even healthy people, their circulation starts to dip right when you get older.
Absolutely.
So that's where I try to keep
So
my.
my
So I try to keep.
protocol is
Mhm.
3 days a week the red light bed, and 5 days a week ozone sauna. I'm set.
Wow. Okay. Okay. So that's where you start though, with the sauna, and then you
Yeah,
go
yeah,
from.
yeah. Again, just make sure that you guys have somebody to kind of help you along on your journey,
Mhm.
because there's so many things we can do. Then you add IV NAD to the mix. Now you're really rocking.
That's why I'd depend on Sonia to test drive all these things, because she knows everything. She knows all the anti-aging stuff, and
Yeah, yeah.
she's the
In
expert.
fact, if you go down to Bulletproof, talk ask them about the Vasper system.
Vasper, VAS.
Vasper VASPR system. So
Yeah.
very
Okay.
quickly, it's basically it's like you going down to Mount Everest and working out for about 21 minutes in the safety of Los Angeles.
Oh my gosh.
Yeah, it's amazing.
Yeah.
I have that machine too in one of my offices.
Oh, cool. Very
And
cool. Yeah.
like I said, Bulletproof. I don't know who came first, but we kind of parallel each other on what we
Yeah. I'll
do.
look it up. Definitely. That's very
Yeah,
interesting. Thank you.
yeah,
Thank you for your
yeah,
time.
yeah. All right, Tanya. I think we're done.
Thank you. We'll see you next week. Everybody have a great day. Thank you, Bryce, for joining us.
Sure.
And I appreciate you. And we're streaming on YouTube, Facebook, Twitch, and our Facebook group page. So again, we'll be back next week for another short health spaces. Thank you, Dr. Kumar, and have a great day, everybody.
Thank you.